This presentation will discuss safe ways for caregivers to transfer people with ALS. Here are some basic rules to follow when performing transfers to ensure they are effective and safe. Use proper body mechanics. Power wheelchairs should be turned off when performing transfers. Locks should be engaged for a manual wheelchair. Use gait belts, sliding boards, BZ boards, or Hoyer lifts appropriately and safely. You want to prepare the environment prior to the transfer. This may involve adjusting the height of the transfer surface or power wheelchair to ensure a downhill transfer. You may have to remove or lift back armrests depending on the type of transfer. You may have to remove leg rests or lift them up on a power wheelchair. When transferring to and from a power wheelchair or manual wheelchair, position it parallel and as close to the transfer surface as possible. Inform patient about transfer being performed and the expectation of them prior to the transfer. It is important to use proper body mechanics to prevent potential injuries to yourself or the patient when transferring. You will want to use a wide base of support, maintain natural curves of the back, bend at your hips and knees, place your center of mass close to the patient's center of mass, move or pivot feet to turn, do not twist your back, and perform the transfer in a smooth motion. A gait belt should be used to control the motion of the individual being transferred. Here are the steps in applying a gait belt prior to transferring. Wrap the belt around the patient's waist, pass the metal tip of the belt through the buckle and over the teeth of the buckle. You want to make sure it's low enough to not dig into their ribs. Next, you will bring the tip of the belt across the front of the buckle and put it through the other side. Adjust it to where you're able to slide your open hand flat between the belt and the patient. The strap should lay flat across the buckle. Tuck the excess under the belt. Ensure proper closure and fitting of belt before use. And always grasp the gait belt from underneath. When performing a stand pivot transfer, ensure the environment is appropriately prepared and the patient is aware of the expectations of the transfer. You will first scoot the patient to the edge of the surface with their feet flat on the floor. The patient will use their hands to push up and the caregiver will cue the patient to lean forward and stand up. The caregiver will often say nose over toes. The patient will use their hands to push up and the caregiver will cue the patient to lean forward and stand up. The caregiver will often say nose over toes. The patient and the caregiver will pivot over to the surface and then they will slowly lower to the transfer surface. When performing a scoot transfer with a sliding board, you still want to make sure the environment is appropriately prepared and the patient is aware of the expectations of the transfer. It is important to note that there are various lengths of transfer boards and the most appropriate length is used. You will want to remove or lift back the armrest on the side the transfer is occurring. Again, you will scoot the patient to the edge of the surface where the feet are flat on the floor. You will want to assist the patient to weight shift on the opposite hip to place 1/3 of the transfer board under the upper thigh or bottom. The transfer will be performed by a series of push-ups or slides down the board. The patient may place hands flat or fisted on the board but may not grasp the edge of the board to prevent the fingers from being pinched. Sometimes a Hoyer lift can be used to transfer a person with minimal effort. There are manual and powered lifts that operate very similarly. Manual lifts have hydraulic cylinders and a hand pump, and powered lifts use rechargeable batteries and push-button controls.